Hi, and welcome to the Star Ambulance electronic run sheet video demonstration. Today I'm going to teach you guys how to use the electronic run sheet software we're going to be using in the ambulances to do our run sheets going forward here into the future. This is a program called AIM, or Ambulance Information Management. It's the same software that we use for our dispatching as well as our billing. It's made by a company called RAM Services. This website, it's all electronic or internet based, so you can use the ambulance laptop, station computer, desktop computer, a personal laptop, even a tablet, basically any device in which you can access the internet browser and can go to this address here. This is ram-services.com. Our company's assigned number is 9080. This will all be saved on the the ambulance laptops and station computers as well. To be able to use that. Everybody's going to be assigned a username and a generic password that you can log in and change to a more custom password when you get yours assigned to you. Today we're going to be Mr. Star. We're going to go ahead and get him logged in here. Once we get logged in here, we are going to see some icons up here in the top right. The one that's going to be important for us here is this one with the 4 squares that says modules. Click on it. We're going to go to patient care. Dispatch will be there. You won't be able to access it. Obviously, it's just for dispatch. Patient care is where we're going to be able to do run sheets. Select that. From here, you're going to have this page brought up here. We're going to go to the queue. We're going to go to the dispatch queue right here. This is going to look for all the runs assigned to whoever is signed in here. Obviously, when dispatch creates a call, they assign a crew to it, generally 2 crew members. Mr. Star here will have some runs assigned to him, and those it will look for all those and bring those up for you to be able to go on and select and finish a run sheet or complete a run sheet. So we'll bring up, got a couple of runs in here for Mr. Star. Setting up these fake calls here for this video demonstration. The one we're going to use today is going to be the second one. It's 2978. So all your calls will be listed here. Any of the ones that you haven't completed run sheets for but have been assigned to you. So we'll go over here. We're going to do the second run here. Use that phone icon. We're going to hit select incident. Now this is important. It's going to bring up some couple of options here. We're always going to select treated and transported by EMS non-emergent. You might say, well, what if we responded and transported emergent? That's what this is for. However, we're going to always use this non-emergent because it brings up the only difference is this has more fields that it forces you to fill out that aren't always even necessary. Things like cardiac arrest. Well, not every patient that's transported emergence and cardiac arrest. So we're trying to reduce the number of fields and boxes that you have to cycle through and fill out, trying to simplify this as much as possible. Also, we're going to be doing SORs on the written paper run sheets anyway, so we're not going to need to select patient refused care or treated and released and things like that. We're going to select treated and transported by EMS non-emergent. Now it's going to bring up this call. You'll see a lot of things are already filled in, and this is nice because it syncs up with our dispatch. So all the information that dispatch is able to gather before a run, and it would come to you in a page and some other things, is going to be already synced up and filled out here in your run sheet. Now, obviously, some runs are different than others. Sometimes dispatch is able to get more information than at other times. Such as 911 calls, we may not even know what hospital you're going to. You may not know until you get there and discuss that with the patient. So sometimes there will be some more information in here than others. They'll put in what they can. Here on this first page, you'll notice that there are things that are filled in, and there are some things that have a blue dark line underneath them, and some that don't. The ones that don't are not requirements. There are spaces you can write in, but we don't have to have anything filled out in there. So, and this is going to be a general theme in this video, is that if it's not required, you don't have to spend any time using it. There's going to be a lot of things that you can just write out in your narrative so much faster than trying to cycle through and find the right checkbox or the right field that you're looking for. We have all the things in there that we need are going to be required, so it won't let you finish the run until you get those. We'll hit that up here a bit later. So on this page, the things that are required that aren't filled out. Complaint reported by dispatch. They may or may not be able to have this, but in this case, I believe it was abdominal pain. So that might hopefully be filled out for you if they're able to get that information. Unit call sign. This is where we're going to be, what ambulance that you were in. Medic 9, ambulance 2, whatever the case may be. We're going to go ahead and we're going to select that we were ambulance 9. You could type stuff in here, but these little quick pick boxes bring up things that are already saved in there and filled out for you. We responded to lights and sirens, and then service level. Mr. Starr, he's an EMT. So this was a BLS call here. Over to crew details. Got to add in who all the crew members were on this call. That obviously can change. Hit crew details here. We're going to add in some crew members. Pop up here. Now you can, once again, you could type things out, select people's certification levels, but this is real nice. Every person in the company, and their PSID number and their certification level is already put there. We're going to go down here and find Mr. Starr and select him. Now, Mr. Starr didn't respond by himself. He had a partner. He was, however, the primary patient caregiver, so response roles here, fill those out. So hitting save would just make it to where there was only one crew member on there. We want to go ahead and hit next in this situation. Allows us to go ahead and add a second crew member for this one click. Go back to repeat the same field here. So once again, let's go see who was his partner. Well, it was Mrs. Starr, of course. We'll say that she drove and she was the secondary patient caregiver. You might have a preceptee. You could hit next, add more onto that, but we'll just say it's just these two rocking that BLS truck today. Hit save. Alright, so there's our crew members. Hop over back to these fields here that go through all the run sheet. You don't have to go in order. You can hop around here. You can jump straight from call information to situation and things like that. But just for today, we'll go ahead and go through all these things one at a time to show you. Now, that's going to slow down the process. You're going to, don't be intimidated. You may think, oh man, this is a lot. This is going to take a long time. Remember, I'm purposely going through all the stuff in here to show you what you do and you don't have to do. You're going to get used to this very quickly and know what fields you have to fill out and can quickly bounce through them, and you'll knock these things out faster than written run sheets eventually. Go to times and mileage. So all these times are already in here as well as that ending mileage. A lot of times, though, there will be some spots missing here. If you start getting your run sheet filled out on the way to a scene or on the way from the scene to a hospital or in between two hospitals, whatever the case may be, it's only going to have the times that dispatch was able to put in there before you started doing the run sheet. After that, you'll have to fill in the rest when you get your times page at the end of the call. So you may have your dispatch notified, unit notified, and then route time on there, but you may be on you to go back and put in your on scene and add destination and all those times in there, as well as your ending mileage. There's a button over here for delays. Don't worry about it. If you do have any delays in transfer for whatever reason, once again, these are things that can be specified in the narrative. Let's go to patient information. On Mr. Doe here, we've got some requirement fields that dispatch was able to put in for us, some of which they didn't know. Name, gender. There's race here. Well, he was an Alaskan native, and we're not sure what his ethnicity was. His birth date, it's already plugged in there, and that fills in the time for, fills in their age in years, so it eliminates us having to do math, which is always a nice feature. And but not every time is dispatch able to get the birth date information. Sometimes 911 call or any other other kind of call where that type of information is not available. So you might have to go back in there and plug in the patient's birth date. Sometimes it might be there. Those will be the lucky times. Incident location. Now this is important. This is where did we pick him up. We did happen to pick up Mr. Doe today at his residence in Crawfordsville, which he lives at 123 Any Street. But we don't always pick up patients at their residences. Sometimes it's other hospitals, nursing homes, or off the highway. This is the incident location. Dispatch should have this plugged in here for you, but it's not necessarily the patient's actual physical address. Down here, personal belongings, you can add in some stuff in there. Once again, another thing that's probably just best to write out in your narrative. More patient information, health information, current medications. I'm going to add some current medications in here. So it brings up this. You can type in some medications. The other thing it has is it does have this extremely long list. If we hit this quick picks, it will bring up a list of hundreds of medications that you can go through and select. I find that once again that takes longer, and I'm all about showing you guys ways just to kind of speed through this and get this faster. Let's just say that Mr. Doe, he takes nitroglycerin. You just start typing. There's nitroglycerin, and add that in there. Is he just on nitroglycerin? Probably not. He's probably on more things. So instead of hitting save, which would just make it to the one medicine, let's go ahead and hit next. Got another medication coming. Let's say he's on aspirin. And let's see, what other is he on? Probably metoprolol, yeah. And then one last thing I do want to show you here. Sometimes we do get those patients that have, 20, 30 medicines listed on 2 different pages. It'd be very time consuming and not necessary to list every single one of those out. You can always list the important ones that you think are pertinent to the specific thing that are going on. And then there's this. List provided to staff. If you've got an extensive list that you're giving to the hospital staff, go ahead and do that. Hit save. So now all our medications are in there. Once again, you don't see anything else required here. There's stuff about their PCP and things like that, but these aren't required. There's these other boxes down here. Some are auto-checked, such as alcohol and drugs. It's going to be auto-checked to none. If you need to change that, you can change your check boxes there, but there's a couple of default ones there. Same thing with barriers to patient care. Let's say he spoke Inuit because he was an Alaskan Native, so we had to speak a different language. Things like that. DNR, environmental food allergies, and obviously a lot of these aren't necessarily applicable, but maybe latex. Down here there is medical and surgical history. Now there's a long list of different and very common medical conditions that you can check box off as many as you want. So we'll say if he has a history of C. diff, he was on nitro, and most likely has a history of coronary artery disease, and aspirin as well. So, and metoprolol, where's hypertension? Let's go find that checked off. There it is. Now there's this long list, but there's going to be some times in which patients have other conditions or issues that aren't going to be on this list. That's fine. We're going to select not available, and then we're going to detail in our narrative what it is that's pertinent. So if they have a condition that is that you feel is pertinent, that is listed, but it's not available in this out of this list, go ahead and hit not available. Write that in your narrative. Hop over here, medication allergies. Same thing as with the medications above. You can hit this and it will bring up a huge list of things you can go through. I find once again that it's just easier to type. So let's just say he's allergic to sulfa. Right there. Once again, if he has more than one, let's just hit next. We'll say he's also allergic to penicillin. There's also, of course, a none option there as well. If they don't have any allergies, you can just type none there. Don't have anything in the relationship page that you need to that's required, so you go ahead and skip that. We'll hop to billing information. The only thing in the billing information that's required of you guys is primary method of payment. Sometimes it's not known, but if we get a face sheet and they have United Healthcare or Blue Cross or something like that, or if they have Medicaid or Medicare, or it says self-pay, you go ahead and plug that in there. Of course, there's going to also be times in which we don't know. Certificate of medical necessity was one required. In this particular run, one would not be required because we picked them up at a residence and took them to the ER for abdominal pain. There's plenty of other calls that inevitably when the medic gets called out and has to take Mr. Doe from Crawfordsville Hospital to St. Vincent's in Indianapolis for a bowel obstruction and pain control, we're going to select, yes, that we need a certificate of medical necessity. In this particular case, though, we know we don't. Don't really have to worry about anything else. This is for those people in billing. Hop down to scene and destination. Once again, some things are auto-filled in for you or grayed out. It's going to be auto default selected to be a single patient and not a mass casualty. You can change that if the one actually does occur. Incident location type. Well, we picked him up at his home and residence, but there's other options here. There's a healthcare facility, so if we picked him up at a clinic, hospital, or nursing home, farm. There's also an ocean, so for those deep water rescues that we occasionally do, you select that there. But in this case, we went to home and residence. Moving on here. Dispatch has that information in here on this particular patient is 123 Any Street. Nothing else required. Down here, we do have all the volunteer and other first responding agencies in Montgomery and Clay County, as well as some other surrounding counties in there that you feel free to check box off. If we happen to go out with Madison Township here, we would check box them. But we responded in Crawfordsville. We didn't have any first responders today, so we'll go ahead and leave those blank. Moving over to destination. We've already got it as Crawfordsville's hospital. Sometimes dispatch will know where you're supposed to take them. Sometimes they won't. So this might be left blank. If it's left blank, you can start typing, but then you're going to have to put in the address, and you probably don't know the physical address of all these hospitals. The good thing is that we've got a huge list of everything over here. Transport locations. They're categorized. You've got clinics, dialysis office, doctor's office, hospitals, nursing homes, or assisted livings in this long-term care facility. But let's go to hospital. Let's just say that Mr. Doe changed his mind and he wanted to go to let's say he wanted to go to IU West Hospital over there in Avon. So we can pull this up, select that, and it went ahead and plugged in all the address, county, and all that kind of zip code and stuff in there. So every hospital in the state's in there, as well as hospitals and places in the surrounding states as well, some of them. Down here we've got other additional information. We've got it auto default selected to be semi-Fowler for transport position. If that needs to change it to whatever's most appropriate there. Transport mode. Did you transport lights and sirens and then downgrade to lights and sirens, no lights and sirens, all these selections here, which is another reason why we can always select treated and transported non-emergent, because it just reduces those number of fields we have to fill out, and we can always then specify here. So we're going to say we did not transport Mr. Doe lights and sirens. Why did he want to go to the place that he went? Well, initially we were going to go to Crawfordsville Hospital. He changed his mind. And so patient choice said that we wanted to go to IU West Hospital. These things are required. The destination type you may have to fill in as a hospital or wherever it is that you're taking them, because sometimes dispatch may not know until you do. So it won't be there. Otherwise, it's ER disposition and hospital disposition. Those will always be as not known. We're not sure what takes place at the hospital once we leave. Nothing more on this page. Hop to situation. Chief complaint. This is your field impression. We're going to say it was abdominal pain. Let's see. Other required areas down here that are pre-selected. See, we have outcome of prior aid, but we just have that. selected as not applicable. This is the kind of stuff that's required by the state, however, is these anatomic locations and things like that. So abdomen, he was having a bowel obstruction, so GI issue. Primary symptom he had was pain, and the primary impression. Well, this is, once again, you'll see there's a list here of some impressions and some complaints listed, and there's associated codes. These are put in by the state. We can't, unfortunately, put any more of these in there, so they have a lot of the common ones, but there's also a lot that they've left out here. So sometimes you're going to be able to select from this list. Other times you're going to have to hit not available because it's not on the list the state has put in here for us. So abdominal pain, however, is one, so we'll go ahead and select that. Nothing else on this page that's a requirement. You see these trauma and cardiac tabs up here. This is things that would force you to fill out if we would have selected treated and transported emergent. But since we're doing the non-emergent, there's just two fields we can go ahead and skip. We'll move on to assessment. This is where we can do vital signs. It already has a spot, or assuming you're going to do one set of vital signs. If you need to add more, you hit that one too. But let's go over here to vital signs, edit, add stuff in. It's going to ask you, well, when did you take these vital signs? We'll just say it was at 1400. As a cardiac rhythm stuff for the medics, you can select your rhythm here. Once again, these are all, it's not required. These are things that can just be typed out in your narrative as well. The things that are required besides the time is you've got pulse rate, respiration rate, systolic blood pressure, diastolic blood pressure. There's some other important ones on here, but not necessarily that we do on every single patient, such as pulse oximetry and things like that. But the other things, these are required. The pulse rate, we'll say it was 88, respiration rate of 18, systolic blood pressure of 140/70. And then the only other thing that's a requirement here is going to be your Glasgow Coma Scale. Go through and select. He was alert and oriented all the way. He has a Glasgow 15. So if you only have the one set of vitals, hit save. If you're entering more than one set of vitals, hit next, and we'll just bring up the same exact page with the spaces or blanks again, so you can put in the new vital signs. We're just going to go ahead and hit save for the one set of vital signs here. Now, down here, it says assessments. You can hit, I'll show it to you. You really don't need to do anything with this. It brings up a lot of checkboxes. All kinds of things to check that you assessed and how they were, and it would be very time consuming to scroll through all these and select all this different kind of stuff. This is where I'm saying, just forget this. Just write out your assessment, your narrative like you always would. I hit cancel here. We're not going to have any of those assessments. Go to treatment. You can select what protocol that you followed. Once again, it's not a requirement. And same thing down here as with that assessment previously, this medication procedures. There's all these different things that you can plug in here. It certainly does not hurt for number of fields that this thing has available to you. There's nothing required here. Obviously, one, we don't start an IV on every patient we transport. And then two, if you do pull up this kind of stuff, it has all this kind of thing. You got to go through the check boxes and go through and fill those out like that. Once again, just writing out how, the details on your IV and your narrative so much faster. Same thing with medication administration or airway procedures and things like that. So we're going to go down here, hit cancel. So you can put in your medications and procedures and IVs and things in here if you'd like, but once again, just jump to the narrative, and you can write these things out a heck of a lot faster. So if we're going to type our narrative from here, you just go ahead and just like you would on a regular written run sheet, how you've always written a narrative, say priority 1 to residents for abdominal pain. And continue typing out your narrative just like you would. If less writer's cramp, and most people can certainly get to the point where they can type faster than they can write. So it speeds things along quite a bit. That's why I stress a lot of go ahead and just write it out in your narrative. Don't necessarily spend a lot of time going through all the check boxes and finding all the fields to check off the things like that. We're going to hop over here to supplemental. The only thing on this page that ideally you should fill out is who made this report. Was it Mrs. Starr or Mr. Starr? It was Mr. Starr. I'll show you the signatures page, but we're not going to do anything with it. We're not going to have signatures on the computers anymore. We're going to have those where we actually have a signature form for the transferring care, for people to sign, things like that. Obviously, the touch screens have a tendency to fail, break down on computers. So, and then of course, a lot of patients. It's very difficult to explain to them how to write on the computer, that they can't touch the screen with the computer, and it's something that's kind of difficult with them. It's so much easier and faster having them sign physical pieces of paper. There's nothing in attachments, and quality assurance is not anything you guys will have to worry about either. So you've got everything filled out. Now let's go ahead and complete this run. We're done with this run sheet. I'm going to go up here. We're going to hit this check box that validate this run and complete it. Now when we do this, it's going to go through and it's going to it's going to scan through real quickly all those required sections that make sure that we filled out. It won't let us complete it unless we have all those filled out. If it finds one, it's going to pop up at the top, and let's just pretend that we forgot to put in the count for the respirations on vital signs. It's going to pop up and say that's missing, and you can select a link. It will take you right to the page, right to the thing that's missing. You can pop that in and be done with it. So we'll go ahead and run this. We'll see. Maybe I did forget something as we scrolled through here. Nope. Found everything. Got all the requirements in. It's going to come up and say, would you like to post a billing? The answer is yes. Yes, we would like to post that to billing. And you're done. It's going to go out to the main screen just like this with the same patient care portal. But you are done unless you've got more run sheets to write, in which you start all over again. So a few reminders about this is that one, it's not going to take this long to write a run sheet every time. As far as the demonstration here, we obviously were showing you things that you didn't have to do as well. You get very used to this, I promise you, and you'll start to speed through these things pretty quickly. Two, there's all different kinds of runs, and you know it's technology, so there will be some computer glitches and things like that. Feel free to ask your coworkers or your supervisors or anybody else who may be more experienced with this program if you're having some issues with it. They can help you navigate that and maybe get some of that figured out. You can certainly call in here, and somebody here in the main office hopefully give you a hand with that kind of stuff as well. And then last key point I keep wanting to stress to people is that you don't have to go through all those check boxes. If it's not required, then you don't have to worry about it. Now you just end up writing longer narratives, but that's still so much faster than trying to find through and go through all those fields and all those check boxes and select the ones you want. So fill out the ones that are required. If it's not, go ahead and let that slide over into your narratives. Thank you for watching. Once again, ask any member of management or supervisors, or if you have any questions, and have a nice star day.